Okay, hi everybody, Dr. Carly here. So since everything has been going on and everyone is stuck at home, I've been getting a lot of emails, Facebook messages, texts, whatever, on different things to do for low back and especially for pregnant patients. So I'm tired of scouring YouTube and the internet to send you guys videos because none of them are how I want them anyways. So I finally bit the bullet and I'm just gonna do these videos. They're probably going to be horrible, but you'll get the point. And I hope that they help anyways, especially while we're all stuck at home. So today we're going to start with some low back extension holds. So if you've ever been to my office, you know that we love low back extension holds. There's a ton of research on them. If you feel like nerding out, it's Barry and Sorensen test that just shows how valuable these are for our low backs. So if you're in the office, you would be using one of these bad boys. This is a low back extension bench. I will actually tag in the comments the bench that we use. Not that I'm affiliated with them or anything, but if you have a little extra workout space for a piece of equipment at your house and you struggle with low back issues, especially stability issues, this is a great piece of equipment to have. They're like $130 or something. So if you're in the office, this is what you'd use if you have one at home. You'd also use it, obviously you hook your feet here, you cross your arms, you come up in a slight extension, you keep breathing here, but you're really focusing on using your low back muscles. Of course, your glutes, your hamstrings, your whole posterior chain is going to be working as well. But you're really trying to use these muscles right here, okay? If you're pregnant, this can actually still be a great exercise for you. You just don't want to extend quite as much. You want to keep almost more of kind of a level position, okay? If you're at home, what you can do, I'm going to show you here with an exercise ball if you happen to have one. You can take your exercise ball, go up against a wall, or your deep freezer, if you're me. You're going to position yourself, again, if you're pregnant, you want to make sure you have a little extra room for your belly here, but you're going to position your hips on the ball, oh, maybe, feet on the wall, and then you can kind of just hold in that position, okay? Again, you're just trying to engage those low back muscles, so if you can feel those working, then you're doing it right. If you're not pregnant, of course, you can be down on the floor. Can you see me here? Oh, yeah. In like a Superman position, okay? That's going to be great too, just making sure that you're breathing through all these movements and that you're not just holding your breath while you're doing them. So what I usually start people on, if you have the extension bench, I would start you with 3 sets of 30 to 45 seconds, you know, kind of resting as you need in between. If you're going to use the ball, it's a little bit easier, so start maybe 45 seconds to a minute and same on the floor. Again, these are just kind of general recommendations. If I'm not your personal doctor, then, and you're having low back pain, be sure to check in with a healthcare provider when you can. But that's what I'd start with, and something that I find really helpful just to stabilize right around your SI joint, which is the joint right at the small of your low back. So let me know if you have any questions. Dr. Carly at Seattle Sports Chiro, or you can find me on Instagram at Dr. Carly.